Good evening, everybody. My name is Jessica, for those of you that have just started watching. I'm being a surrogate mother for a couple in Sweden, so we're really excited about it. I'm trying to keep as up to date on everything as possible. There's so much to it, as far as medications, appointments, flights, traveling, all that fun stuff. I just wanted to let you guys know, for those of you that have been watching, I did get my timeline from CFA, which is Connecticut Fertility Associates. It's the fertility clinic that my IPs decided to go with, so we're really excited. Well, they're really excited because they're having a baby, but anyway, I also got all of my meds, and let me tell you, for any of those who are thinking about surrogacy, we definitely earn the money, or the appreciation or anything that comes with it. So anyway, it's called a timeline. I don't know if all the fertility clinics do it, but CFA does. And they're starting me on the 23rd of this month, so in less than 4 or 5 days. I'm going to start a Lupron regimen. I'll do 10 units once a day, which is just, it's really a small syringe. It's really nothing major. In fact, I'll show you guys really quick here. For anybody who has like diabetes, they know exactly what I'm talking about, but this is literally it. You can't even see the needle on it. So I'll take 10 units of this once a day, and then I have to inject it into my belly fat once a day for until the 28th, and then on the 28th it says, because they've had me on birth control the last 2 months, so what they'll have me do is stop the birth control, and then they're going to, I'll just be doing the prenatals and the Lupron once a day for the 10 units. Then on the 2nd of February, Groundhog's Day, they're going to have me go down on my Lupron. Oh, no, I'm sorry. On this February 2nd, they're going to schedule an ultrasound appointment for me, and blood work to make sure that the Lupron has taken effect, and to make sure that my ovaries are repressed. Basically what the Lupron does is it stops my ovaries from creating eggs, so that we don't have any mix-up as far as the baby goes, because my IPs are using their own eggs. Then on the 3rd, which is the following day, if my ovaries are repressed, then they want me to decrease my use of the Lupron from 10 units to 5 units a day. And then I will have to start S-Trace, 2 milligram tablets, 2 pills by mouth twice per day, and a low-dose aspirin regimen once a day by mouth. I'm not quite sure what the S-Trace is. I'll have to look that up for any of you that are any of those that you are interested in. I'll in my next video I'll answer that question. But anyway, then continuing on February 16th, they will then have another appointment for me for an ultrasound and more blood work to make sure that the uterine lining is taking effect. So that's what the Lupron is doing. If the exam goes well and I will then continue my S-Trace and Lupron, as well as my prenatal vitamins. I'm assuming that the low-dose aspirin is for pain from, possible cramping or anything like that. On the day of the egg retrieval, which for my IPs, she's actually flying down from Sweden. She'll go to Connecticut. At CFA, they're actually going to monitor her for 5 days to see when the eggs are going to be harvested. And then once they're harvested, they'll then fly me out to 3 to 5 days after the embryos have been fertilized. They will then implant them into me, and I start my journey. From that point, actually 24 to 72 hours before I fly out, I have to stop the Lupron and start progesterone oil. So I have to do 1 cc's of that, and let me show you. They actually sent me all of this really interesting stuff, but Anyway, when I saw this, I just about freaked out. It's an 18 gauge needle. And I immediately emailed the CFA and was like, do I really have to shoot myself with an 18 gauge needle? And they're like, no, that's what the smaller needles are for. So the progesterone is actually in a thick oil base, and so in order to get it out right, I have to use the bigger needle and then attach the smaller needle onto it. And I have to inject the progesterone into my butt. So I'm not looking forward to that. They sent me prenates, they sent me all of the medication. Anyway, and then once I start once I start the progesterone, it has to be a morning injection, and I have to take petroleum 2 tabs vaginally until I get a positive pregnancy test. So that's following the initial transfer. So the tablets, they're like little tablets. I'll have to step 2 of them up into my woohoo. But anyway, and so once that's done, they want me to start prednisone 10 milligrams a day and doxycycline 100 milligrams twice per day on the day of donor's egg retrieval. Continue for 5 days after that. And then what they'll do is they'll blood to be drawn 3 to 4 days after the embryo transfer, and they'll do an E2 and progesterone count. Then I guess they'll be looking for, a positive pregnancy test if all goes well. So the timeline is quite complicated, but I'm really excited to actually be starting a regimen for all of this. So after March 5th, hopefully they'll fly me out to Connecticut and we'll get them a baby. So otherwise, there's not much else to really update on. I'm trying to keep everybody in the loop as far as what details go. So if you guys have any questions or comments, please feel free to, leave them on the video. So this was a little bit longer video. Obviously, there was a lot to it. So anyway, I hope you guys have a nice night. Thanks for watching. Bye.